Pregnancy loss can be an incredibly difficult experience for anyone looking forward to welcoming a new member of their family. But for some expectant parents caught in the middle of changing laws, it can also take a significant toll on their mental health. In 2021, Kirsten Hogan found out she was pregnant. Although unplanned, Hogan welcomed the pregnancy, but her abusive partner did not and insisted she get an abortion. She fled to Texas seeking a safe place where she could escape her relationship.
I completely relocated and changed my life to come here, hoping that I would be surrounded by supportive people.
At just 19 weeks pregnant, Hogan's water broke. She was rushed to the hospital.
They told me when I got there that it wasn't likely that my son was going to survive, but we were going to do everything we could. The nurses did their best to provide me with factual information.
Her hospital visit took place just weeks after Texas's abortion law went into effect, which bans abortions after a fetal heartbeat is detected.
The life of every unborn child who has a heartbeat will be saved.
Hospital staff told Hogan she had to stay on bed rest. She was told if she tried to leave the hospital, this could be used as evidence she was trying to kill her baby.
I was held there for 5 days to wait for the inevitable death of my son or birth or my inevitable, death or sickness like sepsis. And the whole thing was extremely traumatic.
Hogan delivered her son stillborn. The experience took a heavy toll on Hogan and her mental state.
I'll be honest, I immediately had to ask my friends to hold my firearms, and I immediately sought professional help because I don't think I would have survived that otherwise.
Research has shown that up to 55% of women who experience a pregnancy loss have symptoms of depression, and up to 27% experience perinatal grief. Hogan said her trauma was compounded by her knowledge that she could have received the care she needed elsewhere.
Had I been in a state without these, restrictions and bans, I would not have endured the situation that I had.
Hogan was part of a group of women with serious pregnancy complications who were denied abortions in Texas. They sued the state last year, seeking more specific guidelines on exceptions to the state's abortion ban. The Texas Supreme Court ruled against the plaintiffs in May, saying the medical exceptions in the law were broad enough.
Texas law allows doctors to exercise their reasonable medical judgment when they are treating a pregnant patient who has a condition that presents a threat to her life or a threat of substantial risk of impairment of a major bodily function.
My name is Amy O'Donnell. For those
Amy O'Donnell, with Texas Alliance for Life, an anti-abortion group, acknowledges that some of the plaintiffs in the lawsuit should have received better care.
We do believe that when a doctor needs to intervene to save a woman's life, that protection does need to be in place.
But O'Donnell defends the law as it stands.
Despite what they're saying that the laws are confusing or that women are being harmed, the law is very clear.
Regardless of politics, one thing remains clear: the importance of taking care of one's mental health when navigating these complicated situations.
I'm here today making sure that I am advocating for women to have a support group and to have a plan in place just in case something like that happens, because you never know what mental state you'll be in when trauma knocks at your front door.
As Kirsten said, a good support system can be vital when facing traumatic life events. This can include a family member, friend, or mental health professional. In the studio, I'm Dr. Nicole Clark, looking out for your mental health.